Okay, as he said, my name is Dean Marcum. I'm with the state of Oregon, Region 9 Liaison, and I'll show you a map and stuff of the state here in just a moment. But I'd like to thank you for inviting me over. One of the gals with the state of Oregon used to work out here. She got in contact with you folks here earlier about starting to do cross-state alliances and stuff, trying to build bigger coalitions. So that's why I'm here. We're trying to bring Washington, Oregon, and Idaho a little closer together. You'll have an Idaho presentation right after this one, and I hope we can start doing that and working together, build our coalitions up so we can all be more a little self-sufficient amongst the eastern side of the states. As in Washington, Oregon is kind of the same layout as you guys are. I have what we call Western Oregon and Eastern Oregon. Western Oregon is everything west of the Cascades is one state. Eastern Oregon is the other way. So that's kind of the way I look at it. Born and raised in the Hermiston area. That's where I came from today. Still out there, been with the state for 11 years, 6 years in this position. And so I'll go through my presentation. It's kind of short here. Be sure and ask questions. Basically, they just want to kind of see what we do as compared to what Washington and Idaho does with HPP, Hospital Preparedness Programs. And I was here earlier this morning. We had a meeting earlier with a few of the folks. And to me, it doesn't look like there's a whole lot of difference. We may look at things a little differently, but the outcome is about the same. So it's not really that different. We're in the regional boundaries. We have 7 regions, like I said. We're Region 9 is where I'm at, which is clear over to the east side of the state over here. Okay, so that's my area that I cover. It's about 200 miles from top to bottom. I've got 7 counties in my region. Ignore this purple line here. That's no longer, that belongs to this area now. But you'll say, okay, you got 7 regions, you're Region 9. Oregon can't count. But no, what happened was a few years back, they've combined some of the regions. We've gotten rid of, because of budget cuts and stuff, we've gotten rid of some liaisons and stuff. Combined them, we just didn't renumber. We just kind of took away a couple of the numbers. That's why it's that way. This just shows basically a map of where our hospitals are within the regions. I've got 7 counties, like I said, in Region 9 up here. And there's generally 1 hospital within each county, except for Umatilla County. We have one in Pendleton and one in Hermiston. Our largest one is down here in Ontario. All the rest of these are 25-bed critical access hospitals. So when we have to transport to either up here, Sacred Heart, wherever, Portland, Bend a little bit. We do a lot of transport up into the Tri-Cities area. Region 8, I've been at 1 or 2 of their meetings up there and talked to them also. So we have good communications across that way. We have 1 liaison per region here throughout the state. 1 HPP liaison, hospital preparedness, and 1 local health division liaison throughout the state to cover those regions as a liaison for the hospitals and the county health folks. Our main office is out of Portland. Everybody knows where Portland is down in here, where all the hospitals are. So fiscal management of that, it's federal grant funded just like you guys. It works through the federal grant funding for the HPP program and the local health division. It's run through the feds, given to Oregon Health Authority. Oregon Health Authority then doles the money out per population per region is how they do it. I don't know if you do it the same way up here, but that's how they base it on population. And then it's up to each region how they want to spend their money. Some regions keep the money in one big lump sum and bring in and do a regional project. Some of them spread it up amongst the hospitals, just hospitals, and others even allow it to go to like county emergency management, just different healthcare providers, county health and stuff. They will share the money. It's just however they want to put the bid up to do it in their budgets. A couple of the regions go up. They've got, say, 7 or 8 entities within that region that want some of that money. They've got $40,000. They have to put in a bid from those entities and justify why they want that. And it's up to the liaison to decide who's going to get that, prioritize and see who get that money or what portion of it they'll get and stuff. So it's actually up to the liaisons and regions how they want to split the money up. It's not said by the state, you have to use it this way in your region. But you still have to meet these capabilities, even though you split the money up, that he was talking about earlier as far as your capabilities and stuff. You have to meet those. Each region regulates a portion, like I talked about, of the spending process. There is required documents. You guys know that. We have to do mid-year reports. We have to do annual reports. We have to go back and do evaluations. You have to do all your AARs and things like that for your exercises and things. You have to abide by NIMS compliancy. We all know that. The liaisons are responsible for the grants. Sure, we do have a budget gal in the office in Portland, but it is the liaison's responsibility to make sure that these regions, all the hospitals and stuff, are following these grant guidelines. If they're not, it's up to us to make sure they do. And if not, we can hopefully take care of that in a polite way. Statewide happenings, as you guys know, everybody's talking about Cascadia Rising. We held a Cascadia East about 1.5 years ago out there because we were hearing a lot of different stories. And what I call Cascadia East, I mean the east side of the state where I'm at. It was the first one we held in the state of Oregon. So we held that and we brought in people from the power company, from FEMA, from everywhere, the meteorologists and stuff. And it really opened our eyes up to what we can and cannot do and what the expectations were. There are a lot of assumptions out there from the feds that Eastern Oregon could handle what they're going to be sending into us if Cascadia hit like they're talking about. And we don't have the resources they were thinking we had out there in Eastern Oregon to take care of this. Not just people, but places where they want to put all this stuff. We're doing the NIMS ICS training. We're doing exercise implementation. We try and do that on a regional basis. But as you guys saw on the map there, you guys, like Washington and Idaho, you're really spread out. It's hard to do a regional exercise and involve everybody, so we're more down to a single hospital agency exercise. You guys were talking about crisis standard of care. I did send that up to Travis, and he can get that out to anybody. It is one that the state of Oregon just adopted about 1.5 years ago that Dr. Richard Lehman with the State of Oregon Health Division put together along with a big group of folks of different agencies and stuff, and it's a very good document. I think it was yesterday I heard, if I'm not mistaken, all hospitals in Oregon have adopted this crisis standard of care, so it's a very good thing. ChemPAC sustainability, is there a ChemPAC up here in Spokane area? Does everybody know what a ChemPAC is? Anybody that does not? I see some heads. It's a chemical antidote bulk storage site. Most of ours are at hospitals, some of them are at fire halls and stuff. That way if there's ever an incident such as organophosphate or something, they can open up these. It is owned by the CDC, but it's put in these places for it to be dispensed up quickly because you need that stuff real quick. And those are throughout the nation at different locations. We have 2 of them, I believe, in Region 9. So we do the ChemPAC sustainability. It's up to the liaison to make sure the contacts are current and stuff on that before they come down and do their annual ChemPAC updates for their sustainability and stuff. And if anything changes or if they have movement stuff, things like that, we have to regulate that. Wildfire Assistance, you were talking about that. That's a big one. We started getting into that more and more here about 2 years ago, I guess, with the big fires down in Southern Oregon. We go out and help do smoke management. Do they need respirators? What do they need? That's part of the liaison's job. We take care of that. If there's any wildfire stuff they need us to help do, we do that. Alternate care facility training, we got into that last year a little bit more. We bring in training from Texas, such as the vulnerable populations training, both from the same outfit. If you've never had training from that outfit out of Texas, and I can get that name to Travis, I can't remember the name of the outfit. Very good training, some of the best training I've ever had. Expensive, but good. Okay. Decontamination training, we do that at all hospital facilities and first responder levels, stuff like that. Make sure they're all up on their decontamination and whatever preparedness training they need, whatever they have. If they have any wants and stuff, we try and fulfill that. If we don't know how to do it, we'll bring somebody in that does. Told you it was going to be short, but you just kind of want an overview of what the state of Oregon does. And then, like I said, it's not much different than what I heard this morning at the table and then at lunch today, so it's pretty much the same. Are there any questions of me for the state of Oregon? Yes? No? Okay. Thank you for allowing me. And I got to give kudos to Elena. She was very good at responding to all my emails. In fact, she was on my case to make sure I got this stuff to her. So really good. You're doing your logistics position real well. It was very good. Thank you.